The state government has started closing down some isolation centers after the state recorded a decline in the number of cases in the state. Lagos was the epicenter of the pandemic before the steady decline. And correspondent Deji Badmus reports the state government says it is retooling its capacity and preparedness to meet the possibility of a likely resurgence.
The Lagos state government's decision to shut down 2 more isolation centers comes just weeks after the first one was closed. But it's not just the decline of new coronavirus cases that is prompting this move. Since the government announced it was starting home care management of COVID-19 cases, the number of patients at its isolation centers have dropped off, with many patients preferring to be treated at home rather than at designated isolation facilities. The state government says just under 100 patients have been treated at its isolation centers at the moment, while about 1,800 are getting treatment from their homes.
So we've got it to a stage where we need to be able to also be able to balance the economics of it, and which of these facilities do we need to keep running. Some of them now are having less than 20% occupancy. And we've seen over time that we can very quickly also wrap up those capacity again.
Treatment for COVID-19 is free in Lagos. Instead, the cost is incurred by the state, but the cost could go as high as $25,000 per day for a severely ill patient that needs intensive care. And it's part of the reasons the government introduced home care management for low-risk patients.
We have seen a gradual decrease in positivity rate in Lagos State over the last 2 weeks, which combined with our increase in testing numbers points to a very encouraging picture of the outcome of our response strategy in the state.
Buoyed by the city's declining number of COVID-19 cases, authorities have now announced a further easing of restrictions. Schools are allowed partial reopening for students sitting final exams. Worship places can resume services, with some exceptions, while restaurants will be allowed dine-in services. But some health experts are warning against rushing to ease restrictions.
We may not be having a high number of cases like we were having before, but then again, it's all boils down on the number of people we are testing, the number of people that are coming forward to be tested. Before, in the past, a lot of people were coming forward to be tested, but now I doubt we still have that kind of zeal.
One step at a time. That's how the government in Lagos says it is approaching this. And despite the lockdown easing, it is also advising residents not to let down their guards, warning that the fight against COVID-19 is very much far from won.